Hi everyone, these are the important questions. Do I need to go for chemotherapy? How many sessions of chemotherapy do I need? What about immunotherapy? What about surgery? What about CT scans? Well, join us on our Simply Healed program every Thursday nights at 7:30 p.m. Singapore, Hong Kong and Philippine time. Our sessions are interactive, featuring a live Q&A with experts and doctors who will answer your questions in real time. You can type in your questions and get immediate, personalized responses. This is your chance to take control of your health. So take advantage of this informative and supportive experience. Visit our Facebook page and message us on Messenger to find out more. See you there this Thursday.
Assalamualaikum warahmatullahi wabarakatuh. Bismillahirrahmanirrahim. Ako si Haji Norma Yusuf, taga Zamboanga City. Pero dito na ako nakatira sa Maynila. 13 pieces na bukol, pero yung mga iba maliit siya. Pero yung itong isa malaki siya, parang umabot na ata ng 3. Kaya nga ito sabi ng doktor, kailangan tanggalin na. May kaibigan ako, i-try ko daw itong yung PPAR. Pangalawang gabi, may naramdaman ako parang iba. Yung parang may langgam na parang gumagalaw ganyan hanggang dito, hanggang sa talampakan, ganon. Pangatlong araw ko. Parang kung sumakit yung dito ko, parang gusto ko talaga. Pag ko ganyan sa CR, yun parang lumabas talaga na ganyan, napakarami talaga. Siguro sunod-sunod yun, 3 araw, ganun. Tapos sabi ko, pagtapos yung dito ko, minsan yung parang, ganun-ganun ako. Parang masikip dito, parang minsan sumasakit dito ko, ganyan. Yung na ako dito, umabot na ng mga 5 days, ganyan. Parang nawala yung sakit dito, nawala siya. Parang hindi na ako ganun-ganon. Pag nagsalita ako, parang tuloy-tuloy na, wala na akong halos maramdaman. Kaya siguro, hindi ako, sabi ko, parang ayaw ko magpa-opera. Siguro, mayroon talagang gamot para dito. Binigay ng God. Ngayon, hanggang ngayon, parang maganda ang, maganda ang pakiramdam ko. Yung high blood ko, pag parang magandang tinanggal ko na yung sa cholesterol ko, hindi na ako, pero yung sa cholesterol ko, pag tinatanggal ko yon, parang hindi, mga 2 araw, parang masama ang pakiramdam ko. Pero ito, 14 days na, ngayon 14 days na, basta 2 weeks na, hindi ako uminom ng subastatin, wala akong nararamdaman na parang maganda ang Kaya yun, ngayon bumili pa ako ulit ng tablet. Oo. Kasi sabi ko para para lumakas talaga sa akin Kasi nararamdaman ko talaga na maganda. Haji Norma Yusuf, ay bukol ako dito sa liig ko, 13 piraso. Umabot na ng 3 cm. Take ako ng PPARs 2 times, morning at saka gabi. Pag numulok ako, hindi ko na siya mararamdaman. At saka kinakapa ko siya, parang nawawala, parang wala na, hindi ko mahawakan. Hindi katulad ng dati. Salamat, SimplyNature.
Father ko muna, start ng take ng PPARs vial para po sa prostate cancer niya. Kasi medyo malala na Stage 4 na siya. Then, nabasag pa yung spinal cord niya. So, lumpo siya, hindi na makalakad, bedridden. Then, before PPARs po, ang putla na niya medyo nakakatakot na. So, while taking PPARs, little by little, yung pamumutla niya nagre-reverse. Namumula na yung pisngi. Nakatulong din sa appetite niya. Then, syempre, sa bowel movement. Kasi mukhang isa yun sa na-paralyze other than his legs. Sa lab test din, pati yung mga red blood cells niya nag-improve na. And yung mga SGPT, yung mga cholesterol, nag-improve din. Then sa energy levels din, kahit na bedridden siya, makulit. Since maganda yung effects, mother ko rin pinag-take ko. Kasi siya naman hypertension, na vertigo rin siya dahil sa hypertension niya eh. So sa kanya, soft gels lang. Yun, ganun din, maganda rin. Nag-i-improve din alongside ng maintenance niya yun, yung PPAR's products. Then all in all, maganda naman. So, syempre, since nagandahan kami, di ako rin. Nakabawas sa stress, nakakasarap ng tulog, mataas din energy. So, ganda. Ganda eh. So, super recommended eh. Ganda nga eh. Kahit headache lang o paghihilo na babawasan, super recommended.
Yung sister ko had the symptoms of diabetes. Siguro 10 years na. Madalas siyang umiihi, tapos laging pagod, pumayat, mataas ang BP. Tapos siyempre, mga non-healing wound.
Yung sa paa po ni ma'am, paano po yun nag-start?
Okay. Kasi ganito yun eh. Yung first na hospital niya, not because of diabetes. Ang una niya, pneumonia. Ayan. Doon nalaman na may diabetes din siya. By accident. Right foot niya, may para siyang matang isda lang. Yung maliit na itim lang. Tapos napapaligiran lang siya ng parang dilaw na kulay na dilaw. Ring sa sugat na yun sa center. Tapos tinanong ko, bakit? Hindi niya daw alam anong reason. So sigurado ko dahil nga may background ako sa medical, siguro dahil yun ay lumala na yung taas ng sugar niya, hindi niya na monitor, hindi niya nabibigyan ng gamot, nagkaroon siguro siya ng komplikasyon. Yung nerve sa paa na damage na. So hindi niya na nararamdaman na minatapakan pala siya. So probably yun siguro yung nangyari. Minatapakan siya, nasugat yung paa niya, maliit lang, tapos hindi niya naramdaman. Lumala. So nagkaroon siya ng lagnat on and off, nakahiga lang siya. So sabi ko sa kanya, so anong plano mo? Sabi ko, pacheck na natin yan. So pinacheck namin as OPD, chinek, binigyan, niresetahan ng gamot, tapos tinignan yung sugat, binusbos. Pero kapiranggot lang ang tiningnan. Tapos in-advisean na lang kami, linis, at 7 days na gamutan ng antibiotic. After na 7 days, lumala lalo. Yung pinaka pamamaga niya, lumaki lalo. So sabi ko, ay, na-infect na to. Nilala ko sa emergency room. Ayun, doon nalaman lahat. Mababa pala hemoglobin, mataas masyado yung sugar, yung diabetes niya, talagang marami ng komplikasyon.
Ano po yung plans ng doktor niya?
Na-refer siya sa ortho. Ang plano sa kanya ay putulin. VKA or the below the knee amputation. Hesitant din kami pumirma ng consent. Then later on, ni-refer naman siya sa plastic surgeon. Nagsabi naman sa amin na maganda pa circulation. Might as well na tulungan na lang natin yung paa, linisin, wound dressing for twice a day, then debridement as needed, religiously. So yun ginawa namin, twice a day kami naglilinis, tulungan kami ng husband niya, hanggang ang nangyari, gumanda, pero andun pa rin yung plan na putulin. Hanggang makita na gumaganda na, ayun, hindi na naulit yung plan nila na maputol yung paa.
Kasabay po ba nun may mga tinitake pa siyang gamot?
Bukod doon sa antibiotics, bukod sa mga gamot na binigay ng doktor sa ospital, may tinake din siya na alternative medicine, yung PPARs. May kamahalan. So, sinugal ko para, kasi kailangan kung di mo isusugal yun, baka maputulan talaga. Kasi kahit naglilinis kami ng paa, tapos nagdidibri, pero parang slow yung healing process niya. So, I tried na painumin siya 10 10 tablets at AM and 10 at lunch and then 10 at the evening. And the soft gel, twice a day also. So, religiously binibigay ko yun sa kanya. Ang dati kasi, dahil nag-peak yung WBC niya, medyo nag-septic siya. Sa mga nakakaalam, sabihin yung infection kumalat na sa buong katawan. Kaya nagkaroon ng problema yung pagkaisipan na nawala sa wisyo. Dramatically, yun yung maganda doon. Dramatically, after 1 to 2 days, parang nakita ko siya ng improvement. Doon, nakita namin na sa help ng antibiotic and together with PPARs, sabi ko, maganda yung kinalabasan. So, why not continue? Hanggang nakita ko rin na gumaganda yung healing process. Tapos yung WBC, nag-dramatically from 46. Imagine, 46, dramatically bumaba siya ng 39, 33, 27, 19, 15, and then 11, 9, 7. So, nakikita mo talaga yung changes na nagawa ng gamot na yun. So, yung support ng family ay mahalaga sa recover ng pasyente. So, una, yun yung talaga nakikita ko, yung support system. Then secondly, syempre, with the help of the advanced technology, like yung mga ini-introduce ng mga gamot, hindi ko pwedeng alisin yun sa scene, sa scenario. So ako kasi, dahil nga nasa medical field ako, medyo alam ko yung mga ganyang mga alternative medicine and evidence-based ako. So sa PPARs, sabi ko nga, maganda yung result. Ito walang harong biro to. It's not joke. Yung mo binayaran eh. So it's no joke. Talagang maganda yung yung nangyari sa kapatid ko, yung lalo na yung wound healing. Yun yung nakikita ko yung wound healing talaga. Nag-granulate siya, nagkaroon magumanda yung circulation, nabuo ng laman, okay? Nagkalaman yung mga paa niya na dating wala. Makikita niyo naman sa picture, di ba? Dating wala, nagkaroon ng laman. So, na-prevent natin yung pagputol. I can say na effective. Okay, effective yung PPARs.
Ano yung ma-advise nyo sa mga patients na same case sa sister ninyo?
Okay. So, I advise them to try. Then, kagaya ko, gusto ko may ebidensya na experience ng on hand ng ate ko. So, ganun din yung papayo ko. Try to experience yung healing, try to take the medicine religiously ha. Despite medyo may konting kamahalan, but then kung titignan mo naman yung long-term na gamutan, mas mahal yun. Tsaka hospitalization. At yung, syempre, yung recovery. Yun yung maganda doon eh. Yung recovery, mapabilis. So, try ninyo. Hello, I'm Joel Elcano. My sister, diabetic since way back 10 years up to now. Because of SimplyNature, hindi niya na kailangan mag-amputate. Yung recovery niya, yung unti-unti, nagkaroon ng maganda, nagkalaman yung kanyang mga paa. Still recovering, yet nakikita ko yung magandang bunga. And that is because of SimplyNature, PPARs. And I trust SimplyNature.
We're always with you from start to finish.
everyone. Welcome to another episode of Simply Nature Answers. I'm Sheila, your host, and we're glad to have you with us. Today, we're diving into real science-based solutions for better health. Simply Nature PPAR supplements, derived from a unique strain of microalgae, are clinically tested to support cancer care, improve immunity, and help reverse chronic conditions like hypertension, diabetes, and high cholesterol. So if you're looking for natural, proven ways to take control of your health, you're in the right place. Today's topic is entitled Dealing with Chronic Illness. Chronic illness is hard. It changes your body, your plans, and your pace. Even on hardest days, you still have no control over key aspects of your well-being. The ability to pause and allow your body to recover, to advocate for your physical and mental health, and to move forward at a pace that supports your healing, because healing isn't all or nothing. It's found in small wins, quiet strength, and showing up for yourself one day at a time. You're not failing, you're fighting, and that's powerful. Just before we start our program, we just want to extend our gratitude to all the doctors, clients, and patients who joined us at the Freedom from Cancer face-to-face seminar last June 7, Saturday at SMX Aura. Your presence meant so much, and we hope that we shared stories and discussions brought you knowledge, hope, and strength. We're honored to support you on your health journey and deeply appreciate your trust in Simply Nature. We hope that you continue to feel empowered, supported, and never alone as you move forward with courage and resilience. Now, throughout the webinar, please feel free to send in your questions by dropping them on the comment section. We'll be answering as many as we can during the AMA or Ask Me Anything sessions at the end of the program. So don't hesitate to engage with us. Now it's time to introduce our health experts for today. First, we have someone many of you already know. She brings both expertise and heart to the way we serve our patients. She is our resident pharmacist and one of the Simply Nature's dedicated client service officers, Ms. Janelle Macanjola. Joining her is a dynamic leader, successful entrepreneur, and seasoned international speaker on a wide range of topics from personal success to healthcare. He is the CEO and founding director of Simply Nature International and PPAR's expert from Singapore, Mr. Shyan Lim. Let's all tune in and learn from their insights. Let's all watch this.
I'm Shen, and today I will be talking about chronic illnesses. The term implies chronic, that means it's long-term. And I'm going to cover a lot today, right? We're going to talk about diabetes, we're going to talk about hypertension, high blood pressure, fatty liver, kidney issues, CKD. We've talked about CKD, I think, a bit more this year because it's really a hot topic in the sense that the field in Asia, at least in Asia, because, I haven't traveled to Europe or the US in some time. So the field, that means the actual field of people in Asia, yes. Kidney diseases are on the rise, all right? More and more people are being diagnosed on CKD, so that's an important thing to talk about. It may not be something that you feel so acutely, right? It's not like a sharp pain that reminds you every day, but yet it's something that's happening in your health in the background. What's scary about chronic diseases is that they will contribute to developing very acute conditions like cancer. Is there a direct link between your hypertension, diabetes, and cancer? The answer is absolutely yes. So if you have chronic illnesses, it is a precursor. Doctors and scientists will use different words, like for example, the contributing factor, foundation, for easy understanding, and maybe a little bit of a hyperbole. It's like a precursor to developing conditions like cancer. Chronic illnesses are actually very serious and they rob you of your quality of life. A question that I think more and more people are asking is, why isn't my condition getting better, even with medication? In fact, your blood sugar is at the same level, but your dosage of metformin or your diabetic drugs is increasing every year. So it's taking more and more drugs to maintain what you have today. Many treatments today focus on controlling symptoms, but it doesn't actually address what's going on deep inside the body, the root cause. Medication is important and is so needed for you to move on with your life, right? You got to bring this blood sugar under control. You got to reduce your blood pressure so that you don't have a stroke. So that's why the medications work. But more and more people realize they need to get rid of the root cause. You can't be living with higher and higher dosages of the drugs that are helping you. Now, what can you do to support your body from the inside? Is there a natural and safe way? Is there actually a solution to solving these chronic illnesses? And the answer is yes. Does this mean that we don't need medicine? No, it does not. In fact, the approach to getting yourself cured permanently, to be off maintenance drug, is to use drugs in combination with what we're going to discuss with you today. So where is the role of drugs in this area? The role of drugs in this area is very clear. Drugs give you the effective, immediate management of your condition. It buys you time. Now, what you do with that time is up to you. You can decide to use that time to get rid of the root cause so that your body totally recovers, or some of us would choose to depend on the drugs for the rest of our lives. But if you choose this option, do know that your dosage will increase as the years go by. And of course, there is always that clear and present risk to taxing and wearing your liver and kidney out, developing other more serious acute illnesses such as liver cirrhosis and kidney failure. So chronic conditions actually start at the cellular level. We'll take a simple example. We'll take a look at diabetes. Diabetes is not a problem of blood sugar. Diabetes is a problem of your cells no longer being sensitive to insulin. Because your cell is not sensitive to insulin, this affects your ability to metabolize sugar, which results in you having high blood sugar in your bloodstream. That is why you want to look for solutions that work on a cellular level if possible. Now, SimplyNature PPARs actually works on a cellular level for all the categories that result in chronic illnesses that are common, right? So it works on metabolic syndromes, so that's going to affect your blood sugar. If it affects your blood sugar, how does it do that? It does that by making the cells sensitive to insulin again. So you can see it's actually going for the root cause. So SimplyNature PPARs doesn't do anything to your blood sugar, right? It actually sensitizes your cells. Now, when your cells are sensitive to insulin, your body is the one that gets rid of the blood sugar. Isn't that a different approach from how the drugs work? SimplyNature PPARs also preserves mitochondrial function. That's how your cells burn energy. So that is anti-aging, all right? Because today, all studies on longevity, that means the goal on most blue zone countries in the world, and Singapore is one of them. What's a blue zone country? A blue zone country is where people's life expectancy is expected to be high, and the quality of their life is supposed to be good, aiming to be good. So these are the blue zones. These are the areas you want to live in. So in countries that are blue zone areas, they are actually talking about helping people live to 120. The goal is to help most people cross 100 years old and stretch it all the way to 120. And all that study is now focused on mitochondrial function. It's talking about how your cells burn energy. It's the battery of every cell, or the generator of every cell. Now, if you're able to nourish, preserve, protect, enhance mitochondrial function, you are effectively anti-aging, or helping your body age healthily. Okay, so SimplyNature PPAR actually triggers and modulates and protects mitochondrial function. So that is why I'm 51 years old this year. I've been taking SimplyNature PPAR tablets since I was 27 years old. I'm the best, I guess, evidence that it works in terms of anti-aging. SimplyNature PPAR is actually designed to activate your body at a cellular level, and that is the reason why it's a root cause approach to treating your chronic illnesses. We have videos as we discuss topics on liver and kidneys. So you check out those videos when you want to learn how our products actually help directly. Okay, let's move on. It seems like every episode we cannot escape this. Inflammation is the hidden driver of chronic illnesses. This is even more clear with COVID-19 and the vaccinations that we had. Even if you were vaccinated, most of us have now experienced COVID-19. Because of the vaccinations, we are able to go through COVID-19 safely, in the sense that the death rate is much lower. But most people actually suffer from the after effects of COVID-19. So in my family, I have a thoracic surgeon and a few doctors in my generation. In our daily family conversations and the so-called gossip that you hear, oh, cousin said this, said that, there is one thing that is clear. The incidence of heart issues has gone up after COVID-19 pandemic, right? More and more people are having heart problems, from heart palpitations to heart attacks to basically cardio issues are on the rise. And the expectation is the next generation is going to see more heart problems at a younger age, right? So now what's driving this is also chronic inflammation. The early days of COVID-19, when they did autopsies, they found that patients who died from COVID-19 had inflammation throughout their body, right? Not just in the specific organs, but throughout their body. So part of the after effects of COVID-19 is an increase of chronic inflammation. And even before COVID-19, we knew that inflammation is the root cause for all our chronic illnesses. It's one of the greatest contributions. One of our doctors that we work with is a pediatric neurologist, right? So she surprised me. She asked me to accompany her to the hospital to speak to the psychologist that is taking care of one of her patients. Her patient is a schizophrenic patient. So I had to go there to explain how the product works to the psychologist, because they wanted to use SimplyNature PPAR soft gel capsules in the hospital while the patient was being hospitalized. So of course, the attending doctor, the psychologist, wanted to know more about the products because the parents wanted to use the products while in the hospital. So I had to be there. Basically, I explained products so it was clear. But after the incident, I looked at the doctora. I said, why did you think about using SimplyNature soft gel capsules for a schizophrenic patient? She said to me, oh, because I understand that your product modulates inflammation. Neural inflammation is one of the pillars or foundation of all mental disorders. So yes, SimplyNature PPAR soft gel capsules will not cure a schizophrenic patient, but it will help calm the patient down. So instead of using psychotropic drugs that have serious side effects when you stop using them, she said she wanted to find something safer with less negative impact on the patient. And the good news is, when the patient was on soft gel capsules, he didn't have to use tranquilizers or use less of them, and he was less of a zombie. He was more alert. So that's good news. So again, here's the example. The inflammation, it actually affects schizophrenia. So it affects all the brain disorders that are so common today: ADHD, autism. A strong component of these diseases, these disorders, are actually inflammation. To be specific, it's neural inflammation. When you are able to modulate inflammation, manage inflammation, you will reduce not only things like high blood pressure, diabetes, kidney failure, you will also reduce your risk of developing things like Alzheimer's, dementia, brain disorders, depression, schizophrenia, anxiety. All this, actually, inflammation has a role in. So you see, one of the root causes of your chronic illnesses is really inflammation. So anything that can help with inflammation is going to be good for you. The last advice is to strengthen your foundation. It's actually basically building on the first two that we're talking about, right? So we're not here to compete with medical treatment. In fact, doctors are so important, because if you're suffering from a chronic illness, it's got something to do with your habits, all right, and how you've been living your life, and you've developed these chronic illnesses. We all know it's not easy to change a habit. So medication is very important, because while you're trying to make changes to your lifestyle and habit, the drugs are going to be effective in helping you manage and control your chronic illnesses. Our encouragement in this program tonight is work with your doctor to manage your chronic illnesses. Don't just stop there. Make full use of what your doctors are able to do for you, which is to bring your conditions under control, and take this opportunity to attack and address the root causes of your chronic illnesses. The general strategy is always the same. Manage your inflammation and get the right nutrition for your body to heal. Right? So if you want to know specifically what you can do for different chronic illnesses, that's what our Ask Me Anything segment is designed for. So if you are viewing tonight and you have a chronic illness that you want to understand more, you want to know what specific solutions are available for you for your chronic illness, you're on maintenance meds and you want to reduce this maintenance meds so that they can last longer in your life, or you want to actually take the opportunity while the medication is helping you control your condition, you want to take this opportunity to also address the root cause, then ask those questions and we'll do our best to help you, to advise you on where you can go and what direction you can take so that you can actually address all the root causes in your chronic illnesses and be free of them. So without further ado, let's move on to the Ask Me Anything segment.
Good afternoon once again. And for those of you who just came in, welcome to another episode of Simply Nature Answers. I am so sure that discussion sparked your curiosity and deepened your understanding about PPARs. So let's not keep you waiting any longer, because good news, we are now in the AMA or Ask Me Anything portion. But before we jump into our questions, let's welcome our new viewers for today, starting off with Miss Mai Nier. Good afternoon po. We also have Miss Leonida Kakuyong. We also have Mr. Jack Way and Miss Vern Vicen. Thank you so much for watching us this afternoon. All right, now at this point, okay, to help answer your questions, I'm so excited to introduce our experts. First, our knowledgeable resident pharmacist and compassionate client service officer, whom you all know well, Ms. Janelle Macanjola. And joining her is a visionary CEO and founding director of SimplyNature International, Mr. Shyan Lim. Good afternoon, Ms. Jen, and good afternoon, Sir Shyan.
Hi, Sheila. Hi, Jen. So good to see everyone. Welcome to another episode of Simply Nature Answers. We have this, I think, twice a month. And of course, we have our regular Simply Heal program that will be on tomorrow night, every Thursday night. So, Sheila, and good to see you, Jen. Jen, looking good and sharp today. Yes, let's go to our Q&A.
All right. So for our first question, well, this is actually a question thrown to us during our Freedom from Cancer last Saturday, June 7 at SMX Aura. Okay, so the question is, what is the composition of PPARs? What is the source of PPARs?
Okay, so many people ask what is PPARs. So Jen is a pharmacologist, so she will also be able to tell you that PPARs is actually not a brand name. It's actually found in your microbiology textbook if you study medicine. But it stands for peroxisome proliferated activated receptors. All right. So that's a mouthful, but just for everybody to understand, here's a common, easy to understand term. It's a gene activator. Okay, so it activates your genes. How does it work? It's a lot like your COVID-19 vaccine. Okay, your COVID-19 vaccine, the new technology one, right, is a mRNA vaccine. So it actually communicates to your cells at a cellular level. It actually gets your cells to produce to produce the antibodies for the virus. So the old vaccines actually introduce the virus, right? Let me give you an example. It's like you take a snake, but you pull out its teeth, right? And then you let the snake bite you so that your body can get used to snake bites. But of course, with the teeth pulled out, the poison that is injected through the teeth can't go into your body. So your body has a safe practice, right? A safe practice with the virus. Now, the new technology of mRNA vaccine actually doesn't send a fake snake or a D2 snake. It literally gives your body the blueprint to produce antidotes. All right, so it works a bit differently from our standard vaccine. So it activates your genes by communicating with your DNA. So that's what PPARs does. All right. Now, what is our PPARs made of? It is not a formula. Okay. So many people ask, is this something we formulated, that we created synthetically, that we combined with something? The answer is no. Our PPARs actually occurred naturally, right? So for I give you another example, is the vitamin C in your orange formulated? It's not formulated, right? It naturally occurs in the orange that you take. Your orange has a natural form of vitamin C. So our PPARs come from our unique algae, microalgae, and in our microalgae, there is a group of long chain fatty acids that have the properties of a gene activator. So when you eat it naturally it activates your genes. So what genes do we activate? Why does it have all these wonderful effects, right? It activates the genes that control, right? That control and affect a few important parts of your body. It affects the immune response, right? So it activates your immune system. Now we can go very technical on how or what it activates, but let's not do that, okay? So if you are interested in that, go to our YouTube channel. You can find that there are actually presentation called Doctor's Forum. Sorry, just a moment. My lovely furry puppy. Just let me handle them for a moment.
No worries. Miss Jen, would you like to add anything?
Yes, so actually, PPARs are receptors found inside your body. What SimplyNature extracted from microalgae are the activators to those receptors. Okay, Sir Shyan is here.
Yeah, no, I think Jen is doing a good job, right? I said the gene activator, she actually explained how it activates exactly what she said, right? There are receptors. Receptors is like the power socket. Okay. And our activator is like the plug in your machine, right? You have to poke into the receptor, poke into the power socket, and you activate electricity starts to flow, and whatever equipment that you plug in starts to work. All right. So we are an agonist. So what do we actually trigger? We trigger the pathways that affect your immune response, how your body's immune system responds. It also modulates or controls how your body reacts and manage inflammation. Also metabolic pathway, so how your body burns energy. That's why it affects your ability to metabolize or control your blood sugar level, control your blood cholesterol level. And last but not least, it actually also helps your body develop or mature your cells properly. So this is very important because we all understand what cancer is. Cancer is a mutant or a wrongly developed cell, right? If you have a cell that doesn't develop properly, it becomes a mutant, it becomes a cancer cell. So when you take the right nutrients, right, and the PPAR agonist helps your cells to develop properly, and that's why it's very it's cancer prevention. In a way, it's really cancer prevention. And when we talk about cancer prevention, people always say, I want to be anti-cancer. How do we do that? You can be anti-cancer, you must lower your inflammation. So that's what we control. You must make sure your metabolic pathways are functioning properly. So diabetes, blood cholesterol leads to hypertension, leads to a lot of issues. It is the foundation. Given long enough, you will develop cancer. So cancer is developed from the root cause of metabolic syndromes. This has been absolutely proven, right? So diabetes is your first step to a long journey. It's not a short journey. It is a long journey, but it's a long journey, but the end destination is actually cancer. So yeah. All right. So I think we gave a very long answer to a short question. I hope that's that gives you an idea. Okay. If you don't fully understand, it's okay. Every time we do a program like this, you hear it again or you hear it from a different angle, the understanding will one day just click.
Well, that's still very helpful for our viewers today, Sir Fan. Thank you. All right. So for our next question, actually, the question that I have here are two, but kind of aligned or the same with each other. Coming from Miss Leonida Kakuyong and Mai Nir. Question is, how long can one take PPARs? Can you take it forever? No time frame, even if you are clear and healthy already? Very good question.
The answer is yes. Where's the evidence? Personally, I'm one of the evidence. I'm 51 years old this year. So if I don't look 51, so there's one good benefit, taking PPAR tablets. I take PPAR tablets every day, all right? Has an anti-aging effect or a longevity effect. So I've been taking it since I was 27. I'm 52 years old this year. So I have been taking it for 24 years. Okay. My Ninong is actually the inventor or the person who created and discovered PPAR, our PPAR microalgae. He's been eating it for more than 50 years, right? About 50 years. Okay. So he lived to a ripe old age. He has already returned to the Lord. Okay, but his wife is still with us. She's in her 80s already. She's also been taking it for that amount of time. And my Ninong does not just take the tablets. Okay, one reason, he's a childhood diabetic. So those of you in Philippines, I'm sure you can all know one very famous person who's a childhood diabetic who defies all the logic of a childhood diabetic. And that is Mr. Gary V, right? Mr. Energy himself. Okay, my Ninong is a similar situation. He is diabetes type 1, so he has diabetes from his teens. He has perfect eyesight even when he was 80. Okay, so that just shows how good the product is. He doesn't just take PPAR tablets every day. He actually drinks half a cup, a small cup of PPAR liquid every day. Okay, now that's really expensive to do so. He can do so because, you know, he manufactures it, right? So he just goes to the all the workers at the factory just let me know, you know, every morning he'll go, and the place where they extract the liquid, he'll take one glass out for quality control. So, you know, they always take a sample out for quality control. So he takes that and he drinks that. So he literally is a good example of taking the highest concentrates of our product every single day for the last like 30 years. Okay. Next is we actually did a scientific test. This test is called the LD50 test. It's called lethal dosage 50%. What does that mean? That means we keep increasing the dosage until half of the population dies. Obviously, you don't do this test on human beings. All right, you don't give a lethal dosage to human beings. So an LD50 test is conducted on animals, right, and specifically mice that have closest DNA to a human being. So what you do is you keep increasing the dosage until half the mice die. Basically, you want to find what is the dosage that will kill half the test population. Okay, so that's an LD50 test. Okay, it's like quite a gold standard test for toxicity. It's also used to check if you keep eating something, will the toxicity, that means will the poison slowly build up. All right, so they keep increasing the dosage until some of the mice start to die, and then they keep increasing the dosage until half of the test animals die. So LD50, 50%. So when we did our LD50 test, it came out negative, which means no matter how much we feed the test animals, none of the test animals had any toxicity effect. Okay, so obviously there's a limit on how much you can test, right? You can't force the mouse to drink like 2 times its body weight of our product. So basically, the amount that the mice take is about 50 times what, I think, yeah, close to 50 times, like 30 maybe 30 to 50 times, because the ratio is not a direct translation of what we humans are taking. So this is just to show you that long-term, no side effects, and there's actually no lethal dosage possible for our products. So we have the real-life experience for long-term. We have many patients that have been taking our product for a long time. There is one particular one that is of interest. This is a CKD patient. So those of you who may not know, but it's important, right, is that once you go on dialysis, just Google life expectancy of dialysis patient. statistically speaking, the life expectancy once you go on a dialysis is about 5 years. So this is very surprising to many people, because many people, when they think of cancer, they think of, I must try and survive 5 years. What many of us don't know is if you are on dialysis, you will probably only survive 5 years. It's a good chance. Not everybody, but statistically speaking, many dialysis patients don't last more than 5 years. Okay, so what happened? We actually have a client who has been that has been going for dialysis for more than 30 years. So what has happened? Every day he's been taking PPAR tablets, and that has actually allowed him to have a very healthy life, even though he's on dialysis. He eats normally, not a super restricted diet, and he actually lived way longer than most than whatever is given for a dialysis patient. All right. So this is one example of someone who took the product for a long time and actually has a medical condition that he shouldn't have lived that long, and yet he did live that long. Okay, and now let's talk about dosage. One last example. I'm just giving all the bases, all right? And then I also would like Sheila and Jen to share, because they handle patients directly. My dog, actually, his record beats mine. Okay? My record in a single day, how much I took was 150 tablets of our micro tablets. Why did I take so much? I wasn't sick. I was actually doing a conference, and I was the keynote speaker. So I don't like to eat when I'm doing conferences, because we have to do Q&A like this, and if you eat, you get sleepy, diba? So what I did was I took the tablets as a literally meal replacement. Okay, instead of taking rice and viand, I actually took lots of tablet as if it's food. Okay, so my record is 150. My dog's record is 600 tablets, because I have the bulk pack, not the ones that you guys buy from us, but the ones that come straight from the factory. Let's be eco-friendly, don't waste packaging. So mine is the big bag. My dog actually managed to climb onto my kitchen table and get that big bag. So one shot, my dog ate 600 tablets. So number one, you can imagine the dog is smaller than a human being, right? I'm 67, 68 kilograms. My dog is only 14 kilograms, right? So I'm 5 times heavier and bigger than my dog, and he ate 600 tablets and absolutely no side effects. No side effects at all. He didn't feel nauseous or anything. He didn't vomit, nothing. So that just goes to show you how safe that you can take the product, and has a long-term, very beneficial. Anti-aging is the most I guess, superficial of all the benefits. But of course, managing your blood sugar level, being healthy, being anti-cancer, that's all the benefits. So I'll leave it to Jen and Sheila to share their experience with long-term use.
All right. I just want to quickly add that, it's actually the same mechanism why our PPARs has no contraindication. You can actually take PPARs alongside your maintenance medication, or even when you are on chemotherapy. We just give, of course, we just give special instruction to our patients. That's why we are very thankful to those who express not only their budget concerns, but also the medications that they are taking at the moment. Okay, so yeah, definitely, just like what Sir Sean mentioned earlier, we actually have well-off patients. They don't have any illness, but they take the protocol that cancer patients take, and the effect on them is actually anti-aging.
Yeah,
So,
for my Ninong, he's drinking the liquid, right? Based on his volume of liquid, it is safe to say he's taking 3 vials a day. So for those of you who know what I'm talking about. But I see a question from Leonida. It's related, right? He's saying PPAR's powder for almost 7 months. Can I alternate to tablets or capsule? Leonida, the answer to this question has got to do is, why are you taking the PPAR powder extract, right? If you are a healthy person with, let's say, mild diabetes, mild blood cholesterol, you don't need to take PPAR powder at all, right? The tablets and is good enough. The soft gel is fantastic for mild conditions like that. Now, if you are taking PPAR's powder, I'm assuming. So please type in and help clarify. I'm assuming you have you have a more serious condition, right? So people who take our PPAR extracts usually have critical illnesses like cancer, very, very serious psoriasis, immunodeficiencies or very, very high blood sugar level, so that they need to bring it down quickly, like literally in hours. They want to see improvement. So these are the times you take the PPAR extract powder. Now you've been taking it for 7 months. Okay, so let me give a scenario. If you are doing it because you have cancer, can you go down to the tablets and soft gel? You can always do so. All right, you can always do so. Now the question is, will this mean that your the results, the therapeutic effect, or why you're taking the powder, will it stop? The answer is it might. Okay, if you have something as serious as cancer, then if your cancer tumor is still there, then we really have to be careful about going down to tablets and soft gels. So I wouldn't advise that if you do change from powder, I would advise that you go to powder to soft gel and tablets together. Okay. Now, this is the only reason I can think that you'll go down to soft gel and tablet is for financial reasons. So this one I totally understand. Okay. So what you then need to monitor is that if you're doing it because financially it's very exhausting, it's tough, all right, then fine. This makes absolute sense, right? So, but you need to monitor, make sure that you go for your checkups, that the cancer tumor doesn't grow back, doesn't come back, your cancer markers don't increase. If it does increase, at least now you know, go back and take the PPAR powder so that you thoroughly defeat the cancer. Now, if the reason why you are taking the powder has been successfully removed, so maybe you had a tumor, maybe you have cancer, and everything is normalized now, yeah, then absolutely you can move to the soft gels and tablets for a little while. How long? I would say about maybe 3 months. Then after that, just the tablets alone should be fine for a healthy person. So for healthy people, there's no real reason I would recommend extract powder, unless you really, really want anti-aging. And even then, you don't really have to take it every month. Maybe once every quarter or every 6 months, you get 1 jar. Normally, you just take tablets and soft gel capsules if you really want. That's already going to give you the results that you want. Okay? Yeah.
She actually answered your question, what is the diagnosis?
Okay.
Hers is suspicious thyroid carcinoma. So that's
Okay,
why
so suspicious, right? So I'm wondering, when you say suspicious, that means it's suspected. Did you confirm that it's thyroid carcinoma? Okay, so if you have a thyroid carcinoma, there should be a lump, diba? So if your lump is still there, then I would say continue, right? If your lump is no longer there, you can change to soft gel and tablets, but you should really monitor, make sure that it didn't grow back. Or even if it grows bigger by a little bit, suddenly no lump from a little lump, you should immediately go for a scan, go and see your doctor. All right. But here's the thing with cancer. So carcinoma is cancer, right? So it's the medical term for it. Here's the thing with cancer. You want to kill it completely. You want to kill it completely. It's like marron mold, pandesal. If there is a little if there's a little green mold on your pandesal, you need to tear the whole, you need to make sure it's totally gone. Diba? You really need to tear it all away. You cannot say leave even a little bit of the mold left. As long as there's a little of the mold left, you go to sleep, in the morning you wake up, it's back again. You got to completely remove it. So cancer is like that. You want to make sure you totally kill the cancer very, very thoroughly. If you leave it alone, if you even leave a little bit of it, then it will come back, and when it comes back, it's more aggressive. So that's one thing about cancer. You don't want to, if you want to thoroughly kill it, right? So if you're not sure how, have a conversation with our pharmacologist, pharmacist, and Sheila. Sheila's experience is her son. Okay, so this is a good person to talk to, is like Sheila, right? Her son is a stage 4 cancer survivor, and he now has crossed his 5-year mark in total remission. You can ask her how. If you're not sure, have a private conversation with her, and you can find out more about when can you when is it safe, all right, to go down to the lower one? Again, here's another thing. Make sure you choose a solution that you can financially sustain. Okay, you don't want to do something that you run out of money halfway, okay, or that you're so stressful, the money part is also stressing you. So again, have a talk one-on-one with our specialists, Sheila and Jen, and they will help you come up with the best plan for you. All right, but and congratulations. I mean, after 7 months, you are. It seems like you're still doing fine. So that's already very good news. Yeah.
That's right. Thank you. Thank you, Sir Fan. Shall we proceed to the next question?
Yeah, sure.
All right. So, question is coming from Miss Minda Banella. For a case where tumor marker is 4.6, can PPAR's tablet alone help?
Jen, you want to comment? Or I'll take it.
Okay. What specific kind of tumor marker is this? Because there's a lot of tests for tumor markers. So we can know if 4.6 is a what level. Okay. And then PPAR's tablet, if it's sure that you still have confirmed malignant cancer, PPAR's tablet might not be enough. So
Yeah,
you should always partner it with extracts.
I will go so strong as to say it's not enough. All right. You only take PPAR tablets if that's the only thing that you can take, then it's better than not taking it at all. But for all malignant tumors, so for cancer, even if you just want to get rid of a benign tumor, I would say that at the very least, honestly, at the very least, is really the powder and liquid extract. If Dr. Johnson is here, he'll tell you, take the liquid extract. All right, it's the best thing that you can do for cancer. Okay, now, yeah. So that's the straight answer. The tablet is only going to give you energy, help you fight your cancer better, but it's not a treatment. It's more like manage your other health conditions while you're fighting cancer. So no, I would really say that if you have any malignant tumors, you need to go for the powder. If you can, the liquid, that'll be best, but the powder is also very, very effective.
All right. Thank you.
So
Thank you, Sir.
I agree with Jen. Yeah.
Agree. All right. Thank you. All right. Let's try to answer one more question. This is once again thrown to us last SMX event. Question is, can a 3-year-old child with eczema take PPARs?
Oh, I'll let Jen answer this one, and then I'll add anything that she might miss. Yeah.
Definitely, yes, and he should. Okay. So to manage the immune system, okay. And 3 years old, don't worry, we don't have any age limitations for PPARs. Actually, our youngest patient is like 3 months old with liver cancer. So what more if just eczema lang? And aside from PPARs, I would also recommend AD Pro.
Okay. So I want to add to Jen. I would say if your child is 3 years old, the PPAR tablets and soft gel capsules, most likely it's going to be PPAR tablets because soft gel capsule is hard for a 3-year-old to swallow. All right, just take more of the PPAR tablets. It's like the best solution for you. Why? As a parent, I am sure you would not like your child to be taking steroids, right? Just by instinct, no, I don't want my child. It's too young to be taking strong medication like steroids. Okay. Why steroids? Because steroids are antihistamines. That means they block your immune response so that you don't have all the reactions. Okay. So for you to understand, eczema is not a skin disease. Okay. So as a parent and for our listeners out there, many people think that eczema is a skin disease. Why? Because it's on their skin. No, it's not. Okay, it is an immune system disease. Why does your skin flake, become red and swollen? It's because your own immune system is attacking your skin. So there's nothing wrong with the skin, right? The skin is reacting to what your immune system is doing. It's not like vitiligo, right? Or for example, I don't know, like infection, pimples infection. Like you pop your pimple and then you have an infection on your face, then it's something wrong with the skin. Okay, it's something wrong. There's an infection on the skin. But eczema, psoriasis is actually your immune system attacking your skin, causing your skin to be inflamed, for it to break. And once you break your skin, because your child scratches, for example, scratches the itch, it breaks and then bacteria go and then you get infected. Then it becomes a skin problem because of the infection. But the original problem of your psoriasis, eczema, is an immune system issue. So that's why you can take medication from inside. You can suppress your immune system so that your child doesn't break out. Okay. Now, of course, having a 3-year-old kid, I think every parent realizes they don't want a 3-year-old kid to take strong medication. Very simple, right? You just don't want your child to be taking strong medication because you're afraid that it will damage his young liver and kidney because he's still growing. You don't want to stress the liver and kidney before it's fully developed, right? That's what your thoughts are, and you are correct. So since eczema is not how shall we say, it's not a immediately dangerous disease, right? You don't die from eczema, right? Well, but your child suffers, right? And of course, it does affect. It stresses their body because they're inflamed, right? But it's not so dangerous like dengue fever. You must take your drugs or else something bad might happen, right? So this one means that you have the option of time. Right? It's not so urgent that you need to solve it immediately. Okay? So because of that, you can explore a natural solution. So this is where the SimplyNature tablets is really your best bet. Okay, I won't even say that you need to take the soft gel capsules or anything because as a child, even at 3 years old, it's going to be 5 to 10. Well, I would say start at 10. 3-year-old can't really swallow, might not be able to chew. It's been a long time since I've been around a 3-year-old kid, so I don't know. I forget whether they will be eating already or not. Okay, solid foods or not. I assume so. But you can crush it. Very easy to crush, and our tablets are crushed straight away into very minute. And then you can put it with their food, okay, or juice. Okay, and then you can eat water best. Don't nothing sugar, because sugary stuff often triggers eczema as well, causes inflammation. Okay, so you can do that. If your child is already chewing stuff, try giving him a tablet directly. You'll be surprised. Most kids eat our tablets like it's meron candy. Okay, especially if you haven't taught your kids to eat sweets, they will eat. It tastes like mongolang. Okay, our tablets taste like green peas, so it's definitely chewable. So if your child chews and doesn't spit it out, he's okay with the taste. Wow, good news. Just give it to him, right? He can easily take at least 10 a day. 15 is fine. If he poops out green poop, don't worry. Okay, that's good. It's because the body displays the green poop. So what? Okay, if you take PPAR tablets, should your poop be green? The answer is the chlorophyll reacted or not? Okay. For many babies and children, when they take PPARs, their poop does become green. The reason is because their body is not very toxic. Okay. Because your body will react with the chlorophyll inside the PPAR tablet. Because the chlorophyll is what gives the color. Okay, that's why it's green. So if your body has toxins, the toxin will react with the chlorophyll. That's why for adults, after living for more than 20 years and eating junk food and pollution and everything, our body definitely has toxins. So when we eat PPAR tablets, the toxins will react with our chlorophyll. That's why your poop is never green, even if you eat 20, 30 tablets, right? The body actually uses the chlorophyll in the micro tablets, in the PPAR tablets, and it uses it to detoxify your body, so it doesn't come out. But because children are clean, their system is not polluted for 20 years, they are still clean. That's why they don't use all the chlorophyll that they eat, so that it comes out. That's why the poop is green. Okay, so don't worry if your son's poop comes out green. It's only good news. It only means he's clean. Okay, that's why the poop is green, because the chlorophyll that he ate was not used, so it came out. But what works is the PPAR agonist in the tablets. It's going to help modulate the immune response. So give us feedback. Once you start your child on the protocol, 10 micro tablets, right? Maybe five in the morning, 5 at night. Okay, and then see the reaction of his eczema. Okay, how long is it going to take? It's going to take about a month. Right? It's going to take about a month. Now, how fast before you see results? It could be as fast as 72 hours. What do you mean? What do I mean by that? Suddenly he's not itching that much. I want you to monitor a few things. I'm sure if your child has eczema, there are certain things that will trigger him, so he will have a breakout. I want you to notice that if you have been taking the PPAR, your baby has a breakout, it takes 3 days for the redness to subside. Now you will notice, it's okay after 1.5 days. It's okay after 2 days. The longer you are on the tablets, the better the immune system has been regulated, and the faster your baby will recover, even if they do have a breakout. Okay, so that's already a sign that they are improving. Now you give it about 3 to 6 months, you should be able to see that your baby is normalized. All right, it recover. But does it mean that your baby will still have breakouts? Yes. As long as you have had eczema, there is always a tendency that if you eat the wrong thing, it will break out. But guess what? If normally your baby's eczema is fully managed, under control, and even when they break out, they will recover quickly. Okay, so this is actually a long-term and a permanent solution to eczema.
Add that not only talking about eczema, but some schools have now started off with their school year. Some students are still on vacation. Either way, this is a strong call out to all the parents out there. If you know your child has a health condition that keeps on coming back, PPARs is the best way to start resolving that. Okay.
Yeah, absolutely. Things like even in Singapore, the scariest thing is if there's a breakout of the foot-mouth disease, because it's very contagious. Once someone in the class has it, it often spreads to all the students in the class. So what keeps your child healthy is not that you can't keep him away from bacteria and virus, because there's no way you can prevent that. You can try your very best, right? But you just don't know. Sometimes by the time the foot-mouth disease has spread, it's already too late. Your kid has already touched his friend's hand and put his hand in his own mouth, and so the virus has already spread, right? So what you want to do to protect your children as they go back to school is this, especially during rainy seasons like this. Rainy seasons are really bad. Why? Because many viruses are communicable by liquid. That means it's not air, it's like COVID, right? It's the saliva. Remember, we used to wear a shield, the face mask and the face shield, because the saliva is the one where it spreads. So you can imagine during rainy season that the atmosphere is very wet. It allows the viruses and the bacteria to spread even more common. So what you really want to do, as Sheila suggested, is boost their immune system. So everybody talk about boost immune system. So it's like all that vitamin C is just one vitamin that's part PPAR tablet actually boosts the immune system in a more tangible way. It increases your macrophage cell activity, your dendritic cell activity, your NK cell activities. These are actually the cells that travels in your body to kill any foreign virus and bacteria. All right, so it's not just antiviral, and it's not just antibacterial, it's also antiviral. Because it really activates your body's immune system. Okay, and we can specifically explain to you what it activates and how it works. And I just did. Okay, yeah, thank you.
Thank you, Sir Shyan. All right, so I think it looks like we covered all our questions for today. And today's topic hits home for many, especially those facing the challenges of chronic illness. As we wrap up, I just want to ask for a very, very quick parting words from the both of you. Who would like to start?
I'll start. So because
Okay.
I talk a lot, so I better let Jen close today. All right. So my thing is, yeah, chronic illnesses is not something that you have to live with. Okay. The word chronic means many people think you have to live with it for the rest of your life. No, it's not true. Okay. Many years ago, if you ask your specialist, that they are called diabetologists, that means they specialize in diabetes. They will tell you that diabetes cannot be cured. It cannot be cured. It can only be managed, right? And it's not me who said it. It's not some integrative doctor or alternative doctor who said it. No, it is the Diabetes Association of America, of US, right? It's the Medical Diabetic Association of of America. They now say that diabetes can be put in remission, which means that you basically have reversed diabetes. So it is possible. So many things that are chronic. So, but reverse doesn't mean it cannot come back, right? So after you reverse it, you can live a wrong lifestyle and the problem comes back. Okay, it's just like you have fever. You can treat your fever, right? You can treat your fever, but you can catch it again. You can catch fever again. So it's the same, right? But the good news now is that now we know we can actually successfully reverse many of these chronic illnesses that we have. And part of the strategy is inflammation and your immune response, and also correcting some of the deficiency at the DNA level. So for diabetes, it's because you're insulin insensitive. So if we make your cells insulin sensitive again, you're basically no longer diabetic. Okay, so I just want to leave that notion with you that there is hope. And I leave the parting words to Jen and Sheila. So thank you very much. I'll see you on the next SNA. And for those of you who want to tune in tomorrow, we will be doing another session on the Simply Heal. Thank you.
Thank you, Sir John. Miss Jen?
It's true. It's unfortunate how chronic conditions like diabetes, high cholesterol, and high blood pressure are so common now that they are considered normal as part of aging. So as pharmacists and PPAR's advisors, we encourage open communication. Please don't hesitate to share with us so we can assess your current health status and recommend the personalized PPAR's protocol tailored for your condition. And take advantage of these free webinars SimplyNature so generously conduct for free. And see you tomorrow night. Bye.
I love it. Thank you. Thank you once again, Sir Shyan and Miss Jen, for answering our questions for today. Now, get ready for the best deals ever, exclusive for direct and website order. Buy a box of PPAR's liquid extract and get a free bottle of PPAR's Plus tablets. That's 2,000 value absolutely for free. Snag a jar of PPAR's powder extract and we'll throw in 7 sachets of Cleansing Plus. Guys, that's a week of detoxing for free. And here's the big one. Buy 3 individual packs of soft gel capsules and get an extract pack completely free. That's a mind-blowing 3,800 worth of PPAR's product at zero cost. Now, these offers are limited and only available here. This is your chance to power up your health with SimplyNature's proven products. So don't miss out and grab yours now. But wait, going because you asked for it. We're back because with another round of 3-day free shipping on all orders of 3,700 or more via www.simplynature.asia. This is an exclusive deal, kicks off starting today and runs only until Friday, June 20. So imagine getting your favorite SimplyNature products delivered right through your doorstep, fast, free, and hassle-free. No minimum fuss, just pure convenience and saving. So we hope to see you tomorrow, Thursday, that's June 19 at 7:30 p.m. for our regular Simply Healed webinar entitled Cancer Journey, Your Next Step. Thank you once again to everyone. We'll see you tomorrow. And remember, your victories in the fight for better health inspire us every day. Because here in Simply Nature, we are always with you from start to healing. Thank you, everybody. See you tomorrow and good afternoon.